Okay, my name's Jessie Toth. I'm here today to talk about alternative medicine again. My audience is nursing students from Herzing University. One of my main points in this speech is to talk about how conventional medicine should not be the only approach to improving one's health, and alternative medicine should be studied and applied more into people's lives and our patients. So I'm going to start by talking about my story with alternative medicine, and we actually talked about this topic today, headaches. I had chronic headaches almost every day for about 6 months, and I was miserable, and I went to doctor, I got a CT scan, I went to a neurologist, I got chiropractic care. Nothing helped, so I'm like, what's going on? I set up an appointment with an acupuncturist and got some sessions done and went on some supplements, whole food supplements, and what they would call Chinese medicine to support my immune system. So after about a month of doing that, headache's gone. I actually very rarely even get a headache, maybe like before we get, have an exam here in class or something, but it's just been wonderful how much it's changed my life, and I really believe that it can be very beneficial to people. So another thing I would like to talk about is some studies that I found of some alternative medicine that really shows the positive effects on people. There was one study of 115 children with ADD and ADHD in Switzerland, excuse me, and 75% were treated with homeopathy. They attained improvement rating of 73% after 3 months. And then the children taking Ritalin showed improvement of just 65% in 3 months. So I think that's really substantial. There was also a study done with asthmatic patients. If 2 grams or 2,000 milligrams of vitamin C was taken before exercise, they reduced their occurrence of exercise-induced asthma attack by 45%. Another study done by Swiss researchers, 1 tablet of butterbur 4 times a day, just as effective as an over-the-counter antihistamine with no side effects. And they actually proved it in Switzerland or whatever as an actual remedy. And there's one lady, Dr. Shadi, who found that if women take adequate doses of green tea or pomegranate, menopause symptoms are dramatically reduced and some symptoms disappear altogether. According to the National Cancer Institute, ingredients found in foods people choose to put in their body can either reduce or increase their chance of being diagnosed with cancer. Roughly 1/3 of all cancer deaths are related to diet and types of food people consume daily. Common food and grocery or organic markets have cancer-fighting properties from antioxidants, and they also have powerful phytochemicals that scientists are just beginning to explore. So, when we're nurses and stuff, that's one thing that we should really emphasize is preventing getting anything. And there's a chart here that I have right here on the bottom. And it's types of searched online health information, and at the very top, people are searching for treatments or therapies, and for prevention, that's right about down here. And I think we can really influence that a lot more if, as nurses, we can research things, if studies are being done. And also another story I'd like to tell you about is my grandmother had a leg ulcer on her ankle. It was the size of her palm for 7 years, open, not healing. Wouldn't show anybody because she's stubborn, but me being a nursing student, I talked to my acupuncturist, and there's a chlorophyll ointment that she could put on that wound. A month later, she's telling me, I see new skin growing in, and the base of it isn't yellow anymore, it's pink. It's like, great, that means it's healing. Now she says, and I think it's about 5 months and she's been putting that ointment on, that big. And nothing else has helped her, so I think that's really great. I haven't been able to find a picture of that chlorophyll with wounds, but I have found this picture of manuka honey. which is a honey they get from European honeybees, and this is open wound 1 day, 2 weeks after therapy, 4 weeks after therapy right here, and almost pretty much healed after 6 weeks. So they're really finding that as a really great breakthrough treatment for wounds and everything. So that's pretty much what I wanted to go over. You know, as nursing students, it's really good to apply what you know, the doctor prescribes and stuff like that, but I really think we'll be coming into more in the future of finding out different things as far as alternative medicine and things to prevent other things from reoccurring. So yeah, thank you for your time.